think it's 12:03 now. Um, I think it's a good time to start. My name's Yan. I'm a research fellow at CPC at University of Southampton. So it's my great pleasure to introduce Dr. Shuang Chen, Assistant Professor in the Department of Social Policy at the London School of Economics and Political Science, where she's also affiliated with Population at LSE. Dr. Chen is a demographer whose research sits at the intersection of fertility, education, and social policy. She also have a particular focus on low fertility in China, fertility transitions, and educational inequality. Her work has appeared in leading journals, including Demography, European Journal of Population and Population Studies, and etc. She received her PhD in Demography and Social Policy from Princeton University, and she previously studied at Stanford University. We're all very honored and pleased to welcome her today. So the presentation will last between 40 to 45 minutes, and then we'll open up the floor for, I'm sure, a lot of questions. So without further ado, please, Dr. Chen.
Thank you, Yan, for the kind introduction, and thank you all for coming in the middle of the summer term. Today, I'll be sharing actually two published papers that are addressing a broader puzzle, and both papers are co-authored with my colleague Stuart Boston, based in the Hong Kong University of Science and Technology. And I think a very early version of this work I presented in the BSPS conference a few years back, where that's also, I think, when I met some of the colleagues who are here today. So I'm very happy to be sharing this work in its final published form. So the goal of my presentation today is to explain a puzzle about why desired fertility is very low in urban China. What do I mean? As many of you here must have known, in most post-transitional low fertility societies, even though the actual fertility has declined to below 2 children, if you look at the average desired fertility, which is usually measured by asking people, what is your ideal family size? So if you look at desired fertility, across most of these post-transitional societies, the average desired fertility actually remains above 2, at or above 2, even though their actual fertility is below 2. So, and this gap between the desired fertility and the actual fertility is very important for several reasons. One is, according to Bongartz, who kind of first uncovered this regularities across post-transitional society, that this gap indicates that the low period fertility we currently observe might be due to temporary factors rather than a quantum effect. And for policymakers and policy implications, this gap can be taken to mean some kind of unmet demand for children. So the fact that people aspire to have more children than they actually have seems to indicate some kind of room for social policy intervention. And indeed, it is actually the premise of a lot of the current family policies and pronatalist policies with the goal of helping people achieve their aspiration, achieve their desired fertility. And for these reasons, Bongartz even consider desired fertility then the most critical determinant of future fertility in post-transitional societies. Now, what's very intriguing is that unlike most post-transitional societies in urban China, actually, both the actual and desired fertility are below 2 children. And this empirical pattern is well known because people who study fertility in China has long also studied desired fertility ever since the 1980s. And you can see it over time. China's desired fertility remained well below 2 children ever since the 1980s and 1990s. And one of the review points out that it's actually also not specific to urban China. If you look at the rural areas, one meta review estimate that even in rural areas, the desired fertility is below 2 children. So that is the focus of what I'm going to talk about. It was just the goal of these two papers is basically to try to understand and tackle this empirical puzzle, right? Like, why is desired fertility low in urban China, unlike most other post-transitional societies? And I think addressing this empirical puzzle is very important for a conceptual understanding of low fertility in China and has very important policy implications as well. As many of you here must know, China's fertility has been persistently below the replacement level ever since the 1990s. And even with the ending of the one-child policy in recent years, it's still not bounced back yet. So there's always a question of, how whether this decline to low fertility can be reversed, can it go even lower, and then what can policy makers do, and how much room do we actually have for policy interventions to reverse the current fertility? And we argue that actually understanding the puzzle about why desired fertility is low in urban China holds the key to a lot of these academic and policy questions. So to address this puzzle first, we want to ask, is desired fertility in urban China genuinely low? What I mean by that is that there's always there's a long-standing debate among scholars who study low fertility and low fertility desires in China. Is that how do we interpret this number, that the fact that average desired family size is below 2 in China? So one group of researchers believe that this low desired fertility means that China or people in China have really embraced some kind of small families norms, and not even small families, even one-child families norms. But other people have pointed out that it's very likely that the true ideal family sizes have been underreported and understated because, as we all know, China has population policies putting restrictions on how many children people can have. I mean, it's most well known as the one-child policy, but we know in practice there is some variation. But overall, it's a society with policy restrictions on family size, which means that if you go do a survey asking people to self-report what's your ideal family size, people could have already factored in the policy restrictions that's put on their family size. In the past, the surveys have tried to tackle this issue by adding a lead-in. So if you look at any of the major China survey of fertility desires, it often has a lead-in of if there were no policy restrictions, or suppose there is no policy restrictions, what's your ideal family size? But previous study shows that even that is still not enough. Even when faced a question with a lead-in, people might still have factored in the policy restrictions when they answer this question, particularly when they're asked this question by interviewers face to face compared to, say, a mail-in survey. Despite this long-standing debate, what I find unsatisfactory is that so far no one has actually empirically tested whether or not policy restrictions actually have reduced the ideal family sizes report in China, and if there is a reduction, then how much? And most of the researchers studying fertility in China acknowledge that there's a possibility of ideal family size being understated, but none of them has really quantified or empirically investigated it. They kind of just move on after this by acknowledging this possibility. And so here's where our first paper comes in, is we really want to understand, have policy restrictions reduced ideal family sizes, and if so, by how much? Another reason why previous researchers haven't studied this way is because it is very hard to empirically do this as long as the one-child policy is in place. So a few studies have tried to tackle this question by, for example, comparing two different surveys in Shanghai. One is face-to-face, one is mail-in, or they have tried to compare alternative measures within the survey, right? One question has the lead-in, the other question didn't have the lead-in, or you tried different lead-ins in the survey. And there are many descriptive analysis. For example, you can compare the desired fertility among people who are eligible to have two children versus those who are ineligible, or you look at regions with more strict one-child policy compared to those with less strict one-child policy. How does the overall ideal family size vary? But you can see none of them is enough to really allow us to attribute any of these descriptive differences or lack of differences they see to the effect of policy. And most of these studies are done quite locally in a small number of cities or counties. So how do we tackle this issue? And we're very lucky because from 2010 to 2015 is a period when the government starts gradually relax and end the one-child policy. And this gives us an idea, which is basically, as the government phase out the one-child policy, do we then immediately see a change in the desired fertility that people report? So this is our design. Particularly, there are 2 points of change between 2013 and 2015. So in 2013, the government first announced a partial two-child policy, meaning that if in couples where both partners are only children are allowed to have two children first. So they are the first group of the population who are allowed to have two children. And then it's not until late 2015 the government announced a universal two-child policy. And luckily, we have survey data before and after the announcement of the universal two-child policy, and both waves have a similar question asking people's ideal number of children. So this setup allow us to then test whether the announcement of a universal two-child policy led to an immediate change in the desired fertility that people report. So I won't go into much details. You can read the paper, but the general design is we use China Family Panel Study, which is a longitudinal survey, and we use the two waves, 2014, 2018, which is right, one is before and the other is after the announcement of the universal two-child policy. We limit to individuals with urban hukou who are most subject to the strict form of one-child policy. And we also look at people who are in the early and mid reproductive cycle so that their fertility desires are still relevant. So we really leverage on the idea that we can observe the same people before and after the policy change to look at whether there's a change in their ideal family size. So more broadly, we use two strategies. One is difference in differences. So you have the treatment group of people who were not yet allowed to have two children before the universal two-child policy. And then there's the control group where they were already allowed to have two children way before that by 2013. Even better is the longitudinal data allows us to identify individuals whose eligibility have changed in that period, and then we can look at the outcome within the same person before and after 2015, and then we can also control for many other time varying controls within the same person. So both strategies actually gave very consistent results. And on the whole, we can see that the changing eligibility from one to two children have led to a significant increase in the ideal family size. People reported by about 0.2 children on average. And it also led to immediate increase by about 19 percentage points in the probability of desiring two or more children. We look at an additional measure of whether it kind of reduces the gap between what people desire and the actual number of children, but you could see this is a much noisier measure and the results are not as consistent. So to address our first question, we were wondering, is the desired fertility genuinely low in urban China? What we found is that relaxing the policy restrictions from one to two children led to an immediate increase in the ideal family size, whether it's measured by the mean number of children or the probability of desiring two or more children. What it means is that, yes, desired fertility is genuinely low in urban China, even though our result also shows that the actual number is moderately depressed by the existing family size restriction. So you could think of kind of two extreme interpretations to begin with, right? Like some people think that kind of some interpretation completely disregard the family size restrictions in China and think a low desired fertility means some innate preference for small families or one-child families. And the other extreme believe that people are purely reporting some kind of artifact of policy, right? Like they're just giving the number that they're allowed to have rather than what they really think. But what our finding shows is somewhere in between, right? It is genuinely low. There is an embracing of small family norms, even though the actual number itself is moderately depressed. What it means is also, again, the gap between this actual and desired fertility might be only just slightly wider than previously thought, but the desired fertility is still low. So now that we've kind of shown that fertility desire is genuinely low, then we want to further ask why, right? What explains this sub-replacement desire fertility in urban China? There are a few hypotheses that deal with this question. Most famously and recently, you might have heard of the low-fertility trap hypothesis, saying that having low fertility in one generation might have resulted in low fertility ideals in the subsequent generation. So if you believe fertility desires to be some kind of upper bound of the actual fertility, then it seems to suggest that there will be a spiral of low and lower fertility in the generations to come. This hypothesis was initially based on empirical evidence in some German-speaking part of Europe, but scholars of China have actually long suspected and kind of hypothesized that one-child policy might have created some enduring norms of one-child families, which actually fits into this low fertility trap idea too. Beyond that, there's actually a much longer standing literature establishing a positive intergenerational association of family sizes. So people who grow up with more siblings tend to have more children themselves. But the biggest question on this literature is this intergenerational association causal or not? And the reason literature has mixed evidence on whether it's causal or not, whether it's your parents' family size causing you to have fewer or more children, or if it's something else that affect both your parents' fertility and your fertility. So the conceptual and the theoretical literature is long-standing, but I think there is a empirical challenge of actually identifying the effect. So in our second paper addressing this empirical puzzle in China, we ask, can growing up as an only child in China lead to lower ideal family size, which then would help us explain one plausible reason why we observe a sub-replacement desire fertility in urban China. So theoretically, there are two classes of explanations of why your sibship size or number of siblings you have could shape your own fertility preferences. One is some sort of socialization process. So as you can see, back in the 1960s, part of this intergenerational association of family size literature has hypothesized that maybe children tend to recreate a familial setting resembling the one in which they grew up in order to mobilize familiar resources, relationships, and roles. And obviously, the numbers of siblings you have, or whether you have a sibling or not, is an important part of this setting that you grew up in that would then affect your own family formation process, behaviors, and ideals. And this idea also is consistent with the theory of planned behavior, which aims to theorize about how fertility intentions are formed. More specifically, the theory goes that you form your own fertility intention by observe your parents' behaviors, fertility behaviors. So by looking at your parents having another child, you perceive the consequences of having a child, both positive and negative, but also by observing their behaviors, you kind of learn what your parents expect and the kind of normative beliefs. And then through these two mechanisms, the theory could predict actually either similar or opposite family size preferences. So it could be that the more children your parents have, the more you want, or you observe some kind of negative consequences of having too many children in your household, how it impacts your parents, how it impacts you, then it ends up leading to some leading you to have actually a preference for smaller family size than the one you grew up in. So apart from the socialization process, there's another distinct class of explanation, which is focused more on the so-called resource dilution, or you might have heard of the quantity-quality trade-off hypothesis in the econ literature. Whatever you call it, the basic assumption is that fewer siblings means your parents invest more resource in you, and then because you get more parental investment in you, you attain more education, and then your educational attainment and occupational attainment then consequently affect your own fertility preferences. So you can see it's not a socialization process, but it's through status attainment and the resource dilution. But the empirical evidence is very mixed on both part of this assumption, at least in the Chinese context. There's no consistent evidence that smaller SIP does lead to increased parental investment. And there's also mixed evidence on whether more education does lead to more or less fertility preferences. So the biggest challenge of studying SIP size and fertility preference is empirical. The reason is that if you think about the socialization process, then SIP size is really, as Duncan and co-authors noted back in 1965, SIP size is really a single specific variable in the socialization environment, and it takes its place among a number of other factors. So the empirical challenge is how can you really isolate this single specific variable in this complex environment? And we also know that to explain the association between your family size and your parents' family size, there are many alternative explanations. For example, it could be through direct norm transmission, right? From your parents' preference to your preference without necessarily going through your parents' actual fertility behavior. Or it could all be due to family background and social class, which affects both how many children your parents have and how many children you prefer. Or it could be something that's not observable, right? Some genetic dispositions that again affects both. And recent research has exactly challenged to what extent we can interpret the association between our SIP size and our fertility preference in a causal way. And one study said, no, it's not causal. And another study said in one of the Nordic countries actually does find some causal evidence. So our design was the goal of trying to estimate the causal effect of SIP size on fertility preference is to use China's initial introduction of the one-child policy in 1980 as some sort of exogenous source of increase in the probability of being an only child. So one important clarification is the instrument we use is really the initial introduction in late 1979, 1980. And this was initially introduced first by some provinces in 1979. And then some of you might not know, one-child policy was never a written down policy document. Rather, it was announced nationally in the form of an open letter in September 1980. So it's important to know that we are not looking at the whole impact of the whole package of one-child policy because we all know that before this initial announcement, China had later longer, fewer antinatalist campaign preceding this announcement. And then a couple years after this announcement, there are also various reforms varying the family size restrictions across regions and over time. So the design we use is what's called a fuzzy regression discontinuity design. So I'm trying to explain this design intuitively to the extent I can. The idea goes that if we can show that this initial introduction of the one-child policy created a jump, something discontinuous, we call a jump, in the proportion of being born an only child, exactly at the birth year of 1980. And if we can also show that there's a jump in the fertility ideals at the same cutoff year of 1980. And if we also see no reasons that any other things jump at 1980, then we could confidently attribute the jump in fertility ideals at 1980 to the jump in the probability of being an only child induced by the introduction of one-child policy. And then the so-called effect of being an only child on fertility ideals is then the ratio between these two jumps. So this is kind of the basic outline of a fuzzy regression discontinuity. So to implement this, we use China General Social Survey. Again, I won't go into the details. And you can see there's an additional empirical challenge of only a few surveys cover one variable, and then other surveys cover more variables. And then so we use a two-sample instrumental variable estimator. We restrict our sample again to urban hukou people who are more directly impacted by the one-child policy restriction in the late 1979 and 1980. So let's look if our strategy works or not. So remember, the first thing we need to observe is whether there is a jump in the probability of being born an only child at 1980 when one-child policy was initially introduced. So this graph is showing you by birth year and the proportion of only child. So we do see a jump or a discontinuity in probability of being born an only child at our cutoff year of 1980, and this gap is estimated to be about 15 percentage points. And the next we want to see then is there also a jump at the same cutoff of 1980 birth cohort in people's ideal number of children. So this top graph is showing you ideal measured by the number of children. You can see, yes, there is a jump down. So an estimated discontinuity of about 0.1 children on average at the cutoff year of 1980. Alternatively, we can look at the proportion desiring two or more children, and there's also a similar jump at 1980 of a reduction by 10 percentage point in the probability of desiring two or more children. So we did a bunch of, and the third thing we have to rule out that nothing else jumped at 1980. So we look at whether people can actually manipulate when their child was born. So imagine if you could know this policy beforehand, and then you'll try to have your second child right before its announcement, and then we found no evidence of manipulation. We also check if there are any other pre-treatment covariates that might have jumped at this cutoff, and then we didn't see any other jumps. And we also use alternative specifications to estimate the jump, and then the results are all robust, giving us confidence in the validity of our fuzzy regression discontinuity design. So across these models, the estimate are quite consistent. So remember, once we establish there are two jumps and then no other jumps, the ratio of the two jumps then give us the effect of being an only child on ideal number of children. We can see that we estimate about being an only child reduces one's ideal number of children by 0.6 children on average, and it reduces the probability of desiring two or more children by about 65 percentage points. We did a bunch of sensitivity analysis with the goal of, again, validating our strategy and our results. So we use alternative windows and specifications for our model. And across these models, we see a significant negative impact of being an only child on fertility ideals, although the effect size varies, depends on the specifications. We also restrict our sample to those who are still young enough to have more children. Again, the results hold. There's concern that maybe it's the one child status directly impacting the eligibility rather than through the SIP chip size to affect your fertility preference. So we control for this period effect of before and after the universal two-child policy. and it doesn't affect our conclusion. And there are also issues about standard error estimation in our empirical setting. We also show robustness checks on that front. There's another important exclusion restriction assumption, meaning that we have to be sure that one-child policy affect fertility ideals not through other mechanisms, but through SIP size. So we can't directly observe this, but we could do some indirect tests to rule this out. First, we might wonder, we all know that one-child policy has the unintended consequences of shifting the sex ratio at birth. So could it be that one-child policy affect fertility preferences through sex ratio rather than SIP size? So we look at the effects specific to men and women, and these sex-specific estimates look very similar, and they're similarly significant and negatives. That means that the effect is not driven by the sex ratio composition. We also know that there's something quite particular about this 1980 cohort, that they've experienced a lot of the social economic changes and policy changes. Particularly, you have the higher education expansion in 1999, which may have directly impacted this cohort's education attainment, which could then confound the impact that we were attributing to SIP size. And what we show is that even among people who were not benefiting from higher education expansion, for example, if they've dropped out of school way before they reach that stage, we observe the same discontinuity in these people's ideal family size. So it can't be due to the higher education expansion alone. We also did a placebo test of people who were born at 1980 but were not only children, right? They do have siblings. So do we actually observe a similar decline in fertility ideals among these people of 1980 cohort who don't have siblings? We don't observe any discontinuity in these people's ideal family size. So that helps us rule out that it is not due to some other unobserved mechanisms that's driving the effect, because these people don't have siblings. These people who have siblings. So for these people, these other mechanisms are not leading to any similar discontinuity in ideal family size. So to summarize, from two papers, we first established that desired fertility is genuinely low in urban China, even though it was moderately depressed by the policy restrictions on family size that was in place. In the second paper, we further showed that growing up as an only child can lower one's ideal family size. On average, being an only child due to this initial introduction of one-child policy significantly reduces the ideal number of children and the probability of desiring two or more children. So we didn't directly test the mechanisms underlying it, but based on the previous literature, we believe that the socialization process is most likely the explanation. Growing up in a one-child family kind of shape the experience of these only children and their idea about the perceived benefits and consequences of having no siblings, and then which then shape their own fertility preference as they grow up. Whereas the literature and the evidence for this so-called resource dilution and then affecting fertility preference through their educational attainment is very thin and contradictory. So what does it mean? More broadly, I think two papers together really provide one of the first systematic empirical evidence that showed a long suspicion that one-child policy has created enduring small family norms or even one-child family norms, which means that the one-child policy, even though it's ended, it has an enduring long-term impact on China's present and future fertility and population change. China's case also attests to a key mechanism of the low fertility trap hypothesis, showing that a decline in actual family size in one generation can lead to a decline in family size ideals or desire fertility in the subsequent generation. So really raising the possibility that fertility might continue to decline across generation. It also illustrates a long-term unintended consequences of one-child policy, but more broadly, family planning policies in and possibly beyond China, which I think future research could test. And then it also shows us that China is really an outlier to this empirical pattern that across most post-transitional societies, you will continue to observe desire fertility at or above two children, even though their actual fertility is below two. So it's really the idea of two-child norms doesn't seem to exist in contemporary urban China. And for policymakers, the fact that there is not only low actual fertility, but there is also low desire fertility below two, really shows that it would be really hard for any simplistic pronatalist solutions to work because precisely that gap between the desire and the actual is so small, indicating a very little unmet demand and room for social policy intervention. And so really we need to think about how to adapt to this persistently low fertility and how to engage in more drastic and institutional reforms to tackle the broad challenges of population aging and stagnation. And I'll end my presentation here and thank you.